today I'm going to be taking Josh's blood pressure by using the blood pressure cuff, and we're going to first start this by gaining consent. Would you mind me taking your blood pressure? No, that's fine. Fantastic. So we just move out the constricting clothing. Maybe it's a jumper, you take the jumper off. We then get the blood pressure cuff and we've got to measure it to make sure it's right. So it should be 2/3 to a half the size. So this is just right for Josh. Then I'm going to line up the artery line on the blood pressure cuff to here. I'm going to wrap this around his arm. Alright, just go under there. Make sure it's tight enough, but not too tight. When doing this on old people, you've got to be really careful because they bruise quite easily. So you've got to try and do it as fast as possible, if possible, and just as gently as you can. So I'm just going to put this in here. Okay. I'm going to be pumping this up to 140 millimeters mercury. So it's going to get quite tight, so you might feel a bit of pressure. Is that alright? Okay, just to find the brachial pulse, so I'm going to put my stethoscope on. And check that it's on here. I was shouting now, sorry. And I'm just going to find the brachial pulse here. Okay, and I'm going to tighten this and make sure the valve's closed, so when I pump it, the air doesn't fall out again. I'm just going to pump it up to 140. Now listen for the systolic and the diastolic pressure. So systolic should be the top pressure, that's when I first hear the heartbeat. I'll slowly release the valve, and the diastolic is when the heartbeat goes. So I've got 130 over 100, which is relatively high. Do you usually have a high blood pressure? Okay, some people do, so you just check with them as well. The usual blood pressure rate is 120 over 80. Today I'm going to be taking Josh's pulse rate and his respiratory rate. I'm going to be asking consent for the pulse rate, but the respiratory rate I won't be asking consent because we want to do this without them being aware, because otherwise it can affect the outcome. The regular rate for a pulse rate is 60 to 80 beats per minute. For the respiratory rate is 12 to 20 breaths per minute. The pulse rate can be taken by the brachial, the femoral, or the radial. Today we'll be doing just the radial. So I'll be placing my 2 fingers just below his thumb to take his pressure, the pulse rate. So I'm just going to gain consent now. Would you mind me taking your pulse rate? Okay. So I'm just going to time it for 15 seconds and then times it by 4. Usually we do this for 60 seconds, but this will be fine today, whilst also taking his respiratory rate. Josh's pulse rate today is 16, so times that by 4 we get 64, which is well within the normal range. And his regularity and strength is also good, showing that the heart is working well. And his respiratory rate has come out as 4, so times that by 4 and you get 16, which is perfectly between 12 and 20, which is the normal rate, so still alive. I'm going to auscultate Kyra's lungs for volume and clarity. I'll be checking for noises such as wheezing, which can be the tightness of the bronchioles, which can be an indication of asthma, crackling, which can be liquid in the alveoli, stridor, which is like a high-pitched noise, which can be an obstruction of the higher airway, or if there's no noise at all, it means the lungs are collapsed. So let's hope not for that today. So first I just need to gain her consent. Would you mind me listening to your airways? It's going to be a bit chilly and it'll be going onto your skin. Stop laughing. Okay. So I'm shouting now. I'm just going to go over here. It's going to be a little bit chilly. Take a deep breath through, please. Out. On this side. I just need to go underneath your top. Is that alright? Is that okay? going to get Josh to come and stabilise her head in case there is any injury there. So, have you had anything else to drink today? No, alcohol-wise? No, and your medical status seems good. We've checked the neurological side of things, and we've done a head-to-toe assessment to check for any other distracting injuries. Now, when I put this on, it's going to be a bit uncomfortable, but it's important to support your neck so that you don't do any further damage. So, what we're going to do is we're going to just measure. Just take a measurement of how far the knee is. So, I do it from one elbow to the shoulder. So, yep, and then no neck. So this is already on what I need it to be. So that's all locked in. If you want to unlock it, you just push the buttons in here, and this side, and then you can change the sizing, and then you just push it back in to make sure it's in place. So I'm just going to put this around. It's going to be a bit uncomfortable. Make sure it's tight. Let me know if it's too tight. Alright, and we've got to make sure that it doesn't stay on for too long because it's not very comfortable. So, everything alright? Does that feel secure? Yeah, it feels like it's holding your hand now. Okay, and we'll keep Josh's hands there so we can change over and put any extra support on later on. Okay, so I've come to her again who has fractured her wrist where the sounds a bit, and I'm just going to explain what I'm going to do. So, I'm just going to assess your wrist, is that okay?
Yep.
I'm just going to expose it a little bit. So do you want to tell me what happened?
I fell letting the cat out.
Okay, and whereabouts did you fall on
My wrist.
Yeah, okay. Now that I've assessed that, I'm going to use the acronym PLUS-DISC, which we use for fractures. So is there any pain?
Yes.
Yep, I bet there is. Okay, what scale of pain are you in? 9. Okay, right. So is there any loss of movement found?
Yes.
Yeah, okay. I see this unusual movement, which is great. And definitely some swelling going on there as well. There's a slight deformity that's a bit swollen here and bent over. And also the irregularity of the fracture you can see here. I'm just going to check for any shortening of the limbs, and also when you're moving, noises. Yep, so there's a sign of practice there. So I'm going to check Clara's cardiovascular and neurological checks just to see if it's okay. So is that okay? I'm just going to go squeeze your finger, okay? So it shouldn't hurt. So I can see the capillary refill is pretty good, and there's definite warmth. So can you see it feeling numbness or tingling? No? No? Okay, that's a good sign. Also comparing it to the other wrist, so I'm just going to look at the other wrist for you. Yeah, okay, so there's a definite big difference between that, especially with the swelling. So your pain score is still 9.
Yep.
So I'm going to give you Entonox. Have you ever had Entonox before? Yep, so you understand that it might make you feel a little bit dizzy, a bit nausea, make you tingly.
Yep.
Yeah, okay, but you'll be in charge of it the whole time. Okay, so you can take it, you can stop taking it whenever you want. So I'm just going to get Josh to bring in the Entonox. Now before I give her any Entonox, I've just got to go through the classification. So have you been diving in the last 24 hours? No? Have you had any problems with your bowels at all? No? No? Okay, and I can see that you can obey commands as well, and I've checked I've checked that your lungs are okay. So you should be fine to take this. Have you got any known allergies at all?
No.
I suppose you wouldn't have if you had it already. Okay, so I'm going to give you the Entonox, and you just take it as you need it, okay? Not the problem. Alright, so you take some of them, and what we're going to do is we're going to put this split under your arm, okay? I'm going to get Josh to support your arm. And I'm putting the towel in there to cushion it so that the arm doesn't move around too much, so it's a little padding. Okay, so we're going to slide this underneath, and then what I'm going to do is I'm going to secure the camera underneath so that it's vertical, and you need it. ulceration on his arm and it's bleeding profusely. So would you mind really adjusting? You're alright with that? So what I'm first do is I'll expose the wound and then I want to clean it. So I've got my saline here, clean from the inside of the wound out because I don't want to wash anything into the wound. Then after, once I've cleaned it all, I'll be getting my dressing ready to pack it. And I want to make this as small as possible to the wound to ensure greater pressure. So I'll wet the saline onto the bandage or onto the packaging because I don't want it to stick to the wound, so I'll just push that there. So if you could hold that there for me, that would be great. And keep packing it. If it's profusely bleeding a lot, we'll put more dressings on, but we'll do this for now. So then I'll just wrap the bandage around. That's great. We want to wrap this around quite tightly. So you tell me if it's too tight at all. So I'm going to keep twisting as I go to really make the pressure even greater. Once we've got all that in, just tap on the hairs. I'll get Josh to elevate his arm as well to try and help with the bleeding. Now if the bleeding's still going, we can apply another dressing or another bandage to tighten it even more. Or if it's really bad, we'll apply a tourniquet, but because these are quite painful, I have to gain consent. So if you happen for me to use a tourniquet, it's going to hurt quite a lot probably, but yeah, okay. So I put this on. The place is 10 centimeters above the wound, but not on a joint. So I'm going to put it here, put it quite tightly. Okay. Now I'm going to tighten this. Let me know if it's too tight. Okay, and put that in there. It's important to date the tourniquet to make sure that whoever takes it off next knows how long it's been on there for. Also, I'll be taking his pulse, the distal pulse, until I hear it stop. If it's still going and the blood flow is still going, then you can apply a second tourniquet, but making sure to document the time. Okay, so I'm going to be demonstrating the LifePak 15, which is a defibrillator monitor. So first we're going to check the batteries. So you turn them over, click both of these buttons to check the lights are on. So these are both full. If they're not, you just pop them out, recharge them, put them back in. So then we're going to turn this round. So first thing I want to do is turn it on using the on button. It should come in naturally into the AED mode, which means it can be used straight away.
Push analyze, connect electrodes.
So press the energy select button and change it across to manual and click yes. So while this is going on, I'm going to do a user test. So I use options and then go through to user test. So I'll leave that going. While that's going, I'll show you what's in the pocket. So in this side we've got the defibrillator cable and the test load, and we've got our pads in here as well. And on this side we've got our SpO2, we've got a CO2 cable which is in here. Now this plugs into the side on here. So that measures your CO2, and then we've also got our 3 lead and our 12 lead cable in there. So this has come through, this has worked, I can see that. Next thing we're going to do is we're going to get our test load out, get that ready. Now I want to change my charge now. So what I do is go on to energy select and scroll down to 50, so we're on 50. Okay, and then plug this in. And I'm just going to do a charge to make sure everybody's clear. Okay, and if you want to disarm it, you just click the button. So I've disarmed that, and we'll do another one just to check it's definitely working. Okay, everybody's clear. And that's the energy delivered, so that's done. I can also change between leads, so I just press lead here and then scroll down. And you can change that to 3 lead or the 12 leads or the paddles. Okay, so that's that one. And then if I want to change the sizing on here so you can see it better, just press size and scroll down, and you can go from 0.25 to 4. So I'll just keep it on 1 at the moment. You can also change the QRS volume. So what you do is you just scroll with this till you get to the corner here that shows heart rate. Click on there, and then you can scroll up or down for the volume. So I'll just keep it a bit quiet now. Also there's the NIBT here, which is the non-invasive BP, sorry, the non-invasive blood pressure cuff, which lives in the back here. And there's also a pediatric one that can be used like in for younger ones. You have to learn to change the paper as well. So under here there's a little lever, you just pull that out, check that there's enough paper in there, so I can see there's enough paper in there, and close it back in again. Okay, I'm going to be demonstrating how to use an NPA, which is a nasopharyngeal airway. These come in a range of sizes, so there's 3 sizes, small, medium and large. You measure these from the midpoint of the nose to the bottom of the ear. So this is a medium, this should be about right. NPAs are used to hold back the back of the tongue off the posterior pharynx, oropharynx, sorry. These are used in oral trauma or in jaw clenching. So if you can't use an OPA, we use these. Generally they'll be unconscious, if not, definitely make sure you get consent or they won't thank you for this. The contraindications of using an NPA can be nasal obstruction or basilar fracture line or a history of epilepticus. You've got to make sure these are the right size, because if it's not the right size, it can go through to the esophagus, which can cause vomiting or hyperventilation and hypoxia through gastric distension. So when putting these in, make sure you put a good amount of lube on them, because you don't want this to damage the tissue in the nose. It's not a very comfortable thing to put in. Okay, you want to ensure that the airway is open, so tilt the head back so it's open. When putting these in, you usually use the larger nostril, and that's generally on the right hand side. So this is the right hand side and this is definitely the larger nostril on this one. So you want to insert this so it's parallel to the mouth and also so that it goes along the nasal floor. If you come across any, if it gets stuck at all, just rotate it. So now I'm going to slowly place this down. Okay, that's all the way in. And then you want to check for chest rise to make sure that it's working and it's correctly in. Okay, I'm going to be demonstrating how to use an OPA, which stands for oropharyngeal airway. These are used to maintain an airway on a patient who may be conscious or semi-conscious. If possible, try and gain consent because it can incur gagging or vomiting. Sometimes they have a clenched jaw if they're semi-conscious, which can make it quite hard to get these in. These come in a range of sizes, 7 sizes, so they come from size 4 to 000. I've got a couple of sizes here. To make sure that these fit and measure them correctly, you need to go from the edge of the mouth to the bottom of the ear. So, try that one. See if that one fits a bit better. Nope, so the orange one fits a bit better in this one. When trying to open the airways, you can use either the jaw thrust, where you just open it like this. This is used for spinal injuries, so that you're not fiddling around with them too much. Or you can use the head tilt for ones that aren't spinal injuries. So you just tilt the head back like this and it should open the jaw. So you get your OPA and you insert it across the soft palate just over the tongue, and then you want to rotate it 180 degrees so it's pointing downwards, and then just push it through the rest of the way and it should go in. This will help to maintain the airways for ventilation. Okay, now I'm going to be applying oxygen to a patient, just using the basic. Oxygen comes in a white container, and we always keep these on their sides so that they don't fall and end up exploding elsewhere. First thing I'm going to do is check my Botox seal on my regulator to make sure it's not damaged at all and sure it's fine. If it is, I'll just replace it because you can't use it. I'm going to get my oxygen, and I'm going to get my seal, line it up, put this in here. Now I want to tighten this just till it's just tight enough, and then give it another quarter of a turn. I also want to check my oxygen is sufficient, so I've got enough. So I'll be tightening the seal to see there's enough in there. See there's a lot in there. So fine for that. Regulate. I'll be checking my flow rates, which I half did then. So just check that these are all working. Okay, so they're all working, and then I'll be making sure that I've got the right mask. So I've got an acute Hudson mask here, which takes 60%, delivers 60% oxygen. So I need to put it to 6 to 8 liters per minute. So I'll connect all my tubing up now. You want to make sure the oxygen's going through the mask before you put it on the patient, and ensure that it's going through properly. So I'm just going to connect this onto here now. sure it's on there nice and tight. So get my valve going, and then get it up to, I'm going to do 6. And I can feel it's going through there. Now I'm going to put my mask on my patient. So I'll make sure I get the consent and say that it's okay to put the mask on. Just put that around the back of the head. And that's oxygen going to your patient. Once the oxygen mask has been finished with, I'll take it off and switch the valve off. And tighten the seal again. Make sure it's completely tight. And then I want to just get rid of any excess air. I'll take these off first and empty the valve out. This needs to be empty. Okay, that's done, and then I'll put it on its side. There's different types of masks that you can use that deliver different percentages of oxygen. So there's a high concentration mask that also delivers a 90% oxygen rate, or there's nebulizers that does 60%. Now I'm going to be demonstrating how to use a bag valve mask. First thing we need to do is check that there's no leaks anywhere at all. So I'll be checking the seals, checking there's no holes in the bag. Looks good now. Also check the regulator on the oxygen, which we've already done, and make sure that there's no damage to that. If there is, then it needs to be replaced, otherwise the oxygen won't get through. I'm just going to attach my oxygen valve now to my oxygen tank. That's attached, and I'm going to bring it up to 15 liters per minute. So 15 there going through. I'm going to insert my OPA while this is inflating. So this is down. I'm going to tilt the head up as well before I put it down. And this goes down straight, and then you twist it 180 degrees, and it goes down in there. So I can see that the bag's inflating here, which indicates that there is no hole at all. I'm going to attach the mask to my patient. So what I'm going to do is I'm going to hold the mantle here and grip it like this. We only want to inflate it 2/3, so we don't want to push the whole bag through, and we're just looking for chest rise. That's chest rise. And we do this once every 5 to 8 seconds. We want to make sure that we don't get gastric inflation, so that the stomach doesn't come up, and we just want the chest rise. If this isn't working, we can get a second person to come and help and apply cricoid pressure, which is here, and that's if it's necessary. Okay, I'm going to be demonstrating how to use the suction unit. This is used in situations where a patient might be unconscious and have vomited and need to clear the airways. So what we do with this to check the suction first and the battery is to turn it on fully, and we bend the pipe and see if it goes, we want it to be at 350 or above 350 millimeters of mercury. So we'll just check that it's working. So that's not working, which means that something's not sealed properly. So I just check all the seals, make sure that's in. Okay, and we'll try again. There we go. Okay, so that's correctly in now. There's 2 types of piping that we use for this. There's the soft one, which is used in moving vehicles, because we don't want to cause damage down the airways. This goes down the NPA, and you measure it from the nose to the ear, which is a bit just like the NP. So, and then there's the harder one which we use, but you can only use this in 10-second intervals or less, because you can cause hypoxia, which can lead on to dysrhythmia. And then to be able to use the suction pipe, you need to turn the patient onto their side in a lateral position, and you only go in as far as you can see. So I'll turn it this way for the camera. So you switch it on. And once it's on, you need to cover the hole to ensure suction, otherwise it won't happen. And then you do it in rotating motions. And make sure you do the suction as you come out. Now if the pipe gets blocked up at all with vomit or whatever, you just use the water bottle, which should be on the side, but it's not on this one, to clean it out. And then at the end of doing all your suction, you take this out by pushing down the bottom, pulling this out, and then opening this up and taking the bag out, and then get changed and cleaned over until piping gets done away. So I've come across this patient here. It's been found by the the party. They've got no history, they just found him unconscious and he doesn't seem to be breathing. So the first thing I'm going to do is I'm going to do my doctor's ABC. So any dangers, there's no dangers around, I'm checking for response. Hello, can you hear me? Hello? So there's no response, then I'll be sending for help. So it's an R49 requesting an R50 backup. I'll be then checking his airways, so I'm just checking his finger sweep, there's nothing lodged in there at all. We listen to his breathing for about 10 seconds, so I just put my face mask here and check for eyes. Okay, so his breathing seems to be happening. I'll be checking his circulation as well. So I'm checking his capillary refill, and so it's a bit cold and a bit discoloured as well. I'm going to get Josh to come over and start doing CPR for me. Anything to that, so I'm just going to move the clothing. So it's important when you're doing the compressions to do 30 to 2 breaths and to have a good position on your body so that you're directly above so it doesn't put stress on you. So the first one here. And the next one goes just right here, mind your fingers. Okay, so I'm turning the AED on now. Yeah. Everything's clear. Clear. Everything clear. So we're inserting an OPA like this demonstrated in the previous video. Okay, and we're using a background mask, and we use this holding a secret jaw thrust to hold the airway open, and you do 2/3 of the bag. So once Josh is ready, chest wise, okay. So we keep doing 30 to 2, and you want to keep switching away every 2 minutes. It can get quite tiring to compression by yourself.
26, 27, 28, 29.
Chest wise, switch on the next one. So we keep doing this, and if we do have ROS, which is return of spontaneous circulation, we'll have to turn the patient on their side to make sure that there's no vomiting, and we can hook the into the recovery position, and we can hook the valve mask up to some oxygen that keeps supplying it. Keep going, otherwise the AED just keeps going and telling you what to do. Bollocks! Bollocks! Bollocks!
I need to do 50 joules.
Oh!
You're doing so well.
What the balls? Bollocks, what's happened? Oh no! Oh, the timing! Oh, it's still recording! Using an NPA, which is known as a blah blah. Which is known as a naughty person airway. Just don't say it, just don't. Things, damn it, bollocks. His handly's still got no PA in there.
Hello! Oh, you need your pants too.
What? What pants?
Did you bring
I've
your
got
pants?
pants.
Oh, cool.
Yeah, I wouldn't let you down, don't worry.
On video from Mark.
Fuck yeah.
Yeah, Mark, we've done!
I'm still putting that in.